Thank you, Administrator. Do you want to finish your comments you were just making?
Thank you. So a 55-year-old couple making $66,000 a year in Grand Island, Nebraska could face an annual premium of over $31,000, and that's on top of a $12,000 deductible. In that same situation in Colorado, that premium would be $32,800. In New Jersey, the premium would be almost $16,000. So we're talking about people having to spend a third to a half of their income on premiums, and that doesn't even include the deductibles. And so if those individuals or that couple have a pre-existing condition, they don't have any protections today.
So I was going to talk about the lowering premiums, but you're lowering for a minority very high premiums that increased since the ACA was passed. So the lower, but you have made efforts and put into place the lowering. What challenges remain to further lowering premiums?
I think one of the things that we need to do is focus on lowering the cost of care. There's been so much discussion about throwing more money, having, at the problem, having more government control. But what we're focused on is lowering the cost of healthcare. Many of the initiatives that we have at CMS, whether it's around drug pricing, whether it's getting rid of administrative burdens that are getting in the way of doctors spending time with their patients and actually increasing costs, whether it's focusing on efficiencies in the system like interoperability and making sure that patients have access to their healthcare records. We're trying to focus on actions that are going to lower the cost of care for Americans. If we do that, more people will be able to afford health care.
Thanks. And I don't want to switch a little bit. I have some Kentucky hospitals that have contacted me about the star rating system before, and their question is they understand the purpose, but it doesn't adequately or reflect the quality that they produce at their hospitals. So I know CMS decided to change the hospital star rating methodology, and so my question is, that some stakeholders requested CMS to remove or suspend star ratings from hospital compare website until the hospital star rating methodology is updated. But what does CMS plan to use the current methodology to update star ratings in early? Can you provide an estimate for the fix of this?
Sure, I appreciate the question. So first of all, I'll start with, as we are focusing on lowering healthcare costs, we think that price transparency is very important, and along with price transparency, quality transparency is important. And that's what the hospital star ratings are all about. I appreciate the comments and the concerns that hospitals have raised about their methodology, and we've made it clear that we want to work with them so we can make sure that Americans have access to quality information that's going to give them the best understanding of what type of hospital and what kind of issues that hospital may have. So we are dedicated to working with them. In the meantime, though, we want to be able to use what we have, because we think it's important for patients to have that information.
Thank you very much.
We will work with them.
Thank you very much. And last week or week before last, I think last week we had a markup on a drug pricing bill here. And the big concern that I've had, and one of the great things that's been bipartisan was the Cures Act, the things that we moved here. And being in D.C., when I talk to people back home that things are working and things are moving forward, it's the blockbuster drugs that are coming out, the blockbuster procedures. In the bill that was, the CBO estimated that 10 to 15 remedies or cures would not come forward because of the impact of the bill. And there were a couple of members on the other side. One that said 10 to 15 would be something you just have to sacrifice for the fact of being able to negotiate lower drug prices. One said that, well, if we have these blockbuster cures, we can't afford them, then what good are they? So essentially, the bill's better than those cures. And my comment was, well, let's come up with the blockbuster cures and figure out how to pay for them and not lose them, because what if that one's Alzheimer's, diabetes? I mean, all the things that are out there. So my question as I get to is one of the ways is value-based arrangements. And I know there are certain things such as Stark Law and other things that kind of get in the way of trying to do the value-based arrangements. Could you talk about value-based arrangements and pay, value-based arrangements for dealing with expensive cures?
Sure. I appreciate the question, and I think we are seeing the advent of new high-cost drugs. We've seen drugs priced at $500,000, $1 million, $2 million, and those are providing hope for so many patients, and because these new medications can actually cure diseases and can actually prevent some downstream costs for the healthcare system over the long term, so they can actually reduce costs. That being said, I don't think that our system is set up to handle this. In the Part B program, we pay the average sales price plus an add-on of, right now it's about 4.5% with a sequester. but it's an add-on payment. So if you think about paying an average sales price of $1 million to $2 million plus an add-on, I don't think the system can handle it. That being said, we do need to think about
Gentleman's
value-based.
time's expired. Chair now recognizes the gentlelady from Illinois, Ms.